Welcome, everyone, to another edition of our annual series on Medicare, What You Need to Know 2025. I'm joined here today with Tamme Nash, who is the owner and insurance agent at the Sable Insurance Agency. She's a Medicare expert. She's been doing these webinars for us for years. And so we'll have Tamme go through the presentation. There's lots of changes in 2025 in the Medicare world. So if you have specific questions about your individual situation, I encourage you to use our text line. We have an automated response set up there. If you text the word Medicare to 716-727-5047, we'll make sure that Tamme reaches right back out to you. And of course, you can always email us here at Level, invest@levelfa.com, or call the office at 716-634-6113. So without further ado, here's Tamme in this year's edition of Medicare, What You Need to Know.
Hello, everybody. Thank you so much for joining me today on the Medicare Made Easy PowerPoint presentation. Wow, another year has passed, and here we are again. Most importantly, thank you, Level Financial Advisors, for trusting me with your wonderful clients, and I look forward to working with you guys always. So without further ado, I'm going to go ahead and start the presentation. What is Medicare? So Medicare is health insurance for entitled beneficiaries 65 years and older, under 65 with certain disabilities, any age with end-stage renal disease, or diagnosed with ALS. The term CMS stands for Centers for Medicare and Medicaid Services. So sometimes people will receive mail that says Centers for Medicare and Medicaid Services, and that is very important mail coming from CMS. So we're going to talk about next the enrollment periods generally with Medicare leading up to when somebody's turning 65, and the time frames that you would be looking at for electing Medicare or special enrollment periods at a glance. So initially, or abbreviated term is IEP, your initial enrollment period is 3 months before the 65th birthday, the month of, and 3 months after. At this time, this is the most busiest time where people can sign on if it's necessary for Medicare through Social Security. So even though we're applying for Medicare, it all starts at Social Security. And if you apply 3 months before your 65th birthday, Medicare will start on the first day of your birth month. You also, once again, can apply on your birth month, and it will start the following month, and then 3 months after. Now, some people miss, unfortunately, the initial enrollment period of time where they should have applied for Medicare. There is another time that those individuals may enroll again or have that opportunity to enroll, which is the general enrollment period, abbreviated GEP. Once again, that is for people that miss their initial. The only issue with that is you can only do that during a specific time of the year. So you may have to wait if you've missed the first one. That time of year runs between January 1st through March 31st of each year. If you apply in January, your coverage will start the month after you apply and thereon for. Unfortunately, during that time period, though, penalties will usually apply. So if you miss your general enrollment period, your initial enrollment period, and you apply during the general, then you will be given an initial penalty, which is 10% for each year you've missed it. Now, a special enrollment period, abbreviated SEP, is for working and covered by large employer group individuals or covered by a working spouse, 20 or plus employees due to carrier rules. SEP basically is for individuals that are currently working, they're turning 65, and they don't necessarily have to jump on the Medicare train quite yet. Those individuals, once again, can wait to take Medicare as long as the group is over a specific number of individuals filed with New York State. Medicare Part B, you do though upon retiring, which is when people use this special enrollment period, or if they've decided just to go ahead and jump onto Medicare and they're going to cancel out group insurance. They have 8 months from when the retirement begins or from when you lose spouse group coverage to apply legally. But most people honestly don't wait that long to apply for Medicare. Most people nowadays are pretty much ahead, if they can help it, to apply for Medicare, and they apply within a month or so of retirement. The other reason why people don't wait the 8 months is because Part D, Medicare drug coverage, must begin 63 days from when retirement begins. Only if, of course, you're already applied in Medicare Part A. So for somebody that has not yet applied for B, and then they retire, they really need to get on the drug coverage because you're only given 63 days. So most people really nowadays really time this out. They ask questions, they kind of are ahead of the retirement, they pre-plan. So once again, most people, if they're applying for Medicare, they're going to do it, upon retirement or when that spouse loses coverage. How do we apply for Medicare? So the easiest way to do it is if you have a portal already set up with Social Security, you can go on www.socialsecurity.gov and follow along with specific criteria to apply for Medicare Parts A or B. You also may visit or call your local Social Security office in your residing county. I do always, though, suggest if you're looking to apply with an individual at Social Security, you probably want to call before going down and set up that appointment. But if certainly you can walk into the Social Security office in most counties and ask questions, but ideally calling the National Social Security office, which is below on your screen, to set up that phone call appointment. Or you can schedule a sit-down appointment by calling this number. This is the national number that is on the screen today. You can call your local offices, but a lot of times if you have bigger questions, we advise calling the National Social Security office. They have level 2 specialists that are able to really answer in detail questions about your account specifically, rather than calling your local office. It's a little difficult. So Medicare and your high deductible HSA. So why would I delay enrolling in Medicare Part A as well? If you are participating in a high deductible HSA plan and you contribute to a HSA account, you will not want to enroll in Part A of Medicare. This is because you are not allowed to participate in another health insurance plan and also contribute to a high deductible HSA at the same time. It's considered double dipping. HSAs are designed to put money aside, tax-free dollars, for medical expenses. And Medicare Parts A and Part B also pays medical expenses. So they feel like it's a clashing, you're not allowed to do both. So when somebody has, been contributing to the HSA, and when they see retirement in the future, it is advised to cease contribution to the HSA 6 months prior to applying for Medicare Part A. This is because once you apply for Medicare Part A, the start date of A will go back retroactive 6 months. Any contributions made after the application for Medicare Part A will not be tax deductible and subject to a tax penalty. This is also some more information about enrolling in Medicare and why we would also delay Part B. Once again, if you will continue to work for your company after the age 65 and you have health insurance through your employer or a working spouse's employer, you will not have to enroll in Medicare Part B. This, though, is as long as your employer group coverage is more than 20 employees. Most Medicare eligibles will not want to pay an extra premium to Medicare and then to group insurance as well. But If you are still working, or if you are covered under your working spouse's employer group benefits, and the employer does have actually less than 20 employees, it is advised that you must take Medicare Part B when eligible. This is due to group insurance carrier rules. If you do not take Part B when eligible for your group insurance, with your group insurance, your carrier may not continue to pay your claims unless you take Medicare Parts A and Part B, which is the case would become your primary insurance and group would be secondary. So a lot of people, I see this often, they're still working, they're very happy, they have a family on the plan, and they're like, why should I jump on the Medicare train? And once again, it's not necessarily that Social Security is going to say you need to take it because you've had continuous group benefits. It's the insurance that's carrying through the group. They constantly audit, and they're looking for people that are turning 65. And if the business is filed with New York State as being less than 20 employees, they want you to take Medicare because they want Medicare to help pay for claims. And I've seen it where people don't. They honestly, sadly, really don't understand the rules. They weren't advised properly. And they get months after their 65th birthday, they're past that initial election period, and all of a sudden they go to the doctors, and the doctor says, well, your insurance retracted claims paid out because you should have been on Medicare. And that's when people then really, have to scramble. And sometimes, once again, if we go back to our original slides, we're not in that general enrollment period time of the year, January through March, you would have to wait to get on Medicare, and that is where penalties will apply, and also claims can be at risk with being paid. If somebody is receiving Medicare due to a disability before the age of 65, the number of employees under your working spouse's group coverage and the rules of waiving Medicare Part B are different. It is definitely recommended always for beneficiaries to call Medicare before waiving Medicare Part B benefits if the disabled eligible is covered under a working spouse's large group carrier. So, a lot of times when somebody is covered under their spouse because they were just deemed disabled, Medicare then, 24 months from that legally disabled has been deemed, all of a sudden, sometimes without your warning, you will receive a Medicare card. And sometimes people think, well, hey, I don't need this. I'm covered under my working spouse. But if that group plan that you're covered under is under 100 people in the plan, you must keep the Medicare. The rules can change. So we always, always, always recommend calling Medicare before waiving the Part B if you are disabled. So here is this Medicare card that we are talking so much about today. This is the basic standard card and what it looks like since 2018. Prior to 2018, the card looked a little bit like this, but a lot different because it used to have your Social Security number on, or if you were covered under a working spouse's Social Security, it would have your working spouse's Social Security number, as well as the dates that A and B went into effect, and a signature, which was a huge breach where people could really steal identity. So after 2018, Medicare did go ahead and update the card with just your name, random letters and numbers that are assigned to you and Medicare, as well as the dates that your Medicare went into effect, but with no signature for your protection. Okay. So I'll just talk about the parts of Medicare and what do they actually cover. So Medicare Part A, the first one, I always tell my clients, it's like the government saying, happy birthday. If you've paid into FICA at least 10 years or 40 quarters, you are automatically given Part A with no additional costs to you. What Part A will cover is 80% of services inpatient hospital, 80% in skilled nursing, home health care, and hospice care. Part B, also 80% covered, but with a cost, which we'll get on to in the next slides ahead. Part B covered services are covering 80% outside of the institution of the hospital. So medical expenses that go to your primary, diagnostic tests, specialists, anything that's happening outside of the hospital, medical expenses will go against the B. Home health care, outpatient hospital services, as well as, once again, durable medical equipment. Okay, so this slide, this is, of course, the 2025 rates today. As I sit here in the very first week of October, if you can believe it, we have been licensed and educated and ready to talk about 2026, but the government has still yet to tell us and inform us what the cost of Medicare will be in 2026. There is estimations out there at the moment, but we are still not certain what that is going to truly look like. Usually by the end of October, early November is when we get the information about the adjustment of Part B costs. Now, what you're going to see on this slide is very interesting because you're going to see not just one cost for Medicare, but a sliding scale depending on what your income is. So how Part B costs are determined is this year, they look back when you apply for Medicare or put into Medicare, they look back 2 years at your modified adjusted gross income on what you filed either individually or joint or separate. So this year in 2025, we are looking at what is filed in 2023. And in front of you is going to be a sliding scale of the basic amount right now for individuals under 106,000 filed in 2023 or filing joint under 212,000 in 2023. Your average cost would be $185. But if you look down, you'll see higher costs associated if your income is in a different bracket. You'll also see not only on the Part B cost being adjusted and higher as your income may go up, also the Part D drug coverage, basic Part D, will also be assigned at a higher cost, all coming out of Social Security, not going against your new health insurance, but all coming out of Social Security. Now, when you see that sliding scale go up, another term for it is IRMA. IRMA, you will hear a lot as somebody turns 65 and they may fall into those higher cost categories. What IRMA stands for is the income-related monthly adjustment amount. Social Security, upon applying for Medicare, will review your MAGI, which stands for the Modified Adjusted Gross Income that I said earlier. This is the sum of your adjusted gross income and tax-exempt interest income. IRMA is an additional fee added to your standard Medicare Part B and Part D premiums if your MAGI exceeds those certain thresholds. Reference the chart prior. These thresholds are based on your tax information from 2 years prior. So for 2025, IRMA is generally based on your 2023 income and tax return. Appealing IRMA. You can appeal it. So often I'll have people come in and we're going through this information and they're shocked. I mean, out of the many people I see in a week, about half of them don't really realize that Medicare actually comes at a cost, Medicare Part B. So when we go through this with them, they're absolutely shocked. And a lot of them will say, well, hey, wait a minute. You know, in 2023, I was up here in income, but now I'm retiring. That's all tapering down. So you can appeal IRMA. If your MAGI has decreased due to a qualifying life-changing event such as retirement, marriage, death of a spouse, or divorce, you can file a form, which is the SS/44 form, with the Social Security Administration to appeal the IRMA determination. This form can be found on your Social Security site to print or download, with instructions to the appeal process due to your personal qualifying life event. I actually never get involved in people's financials, but I always recommend, you know, obviously talking to Level and then or calling Social Security directly before, you know, deciding on doing the appeal, or actually asking more questions about the appeal process and when would be appropriate for you to do that. So you're always going to want to lean on, you know, Level for that, or you can call with the number earlier in the slideshow today that I had provided. The national line is also very, very helpful with that. So paying for Part B. Clearly there's a cost for it. We all saw that, and there's only a few ways you can pay it. If you're already collecting Social Security income, it will be taken out monthly from your Social Security check. For people that are deciding to wait on taking Social Security retirement, or Social Security income, I should say, until they're at their full initial retirement age or later, they then will be billed quarterly every 3 months for that Social Security premium. So you'll get a monthly bill, or I'm sorry, a quarterly bill. If you receive a low-income subsidy, another term for that is MSP, there's actual information with your state that you can apply to have the state pay for your Medicare Part B premium. So some individuals with low income, there is a specific application that we can provide, as well as Social Security can provide, to try to help get the Part B premium paid for. That does not mean you're not going to have Part B. It's just the state will help pay for it for you. And then also, lastly, the last little bullet I almost missed is some Medicare Advantage plans may help to pay for your Medicare premiums in 2025, and there is even plans in 2026. So certain Medicare Advantage plans, what we'll get to in a moment, what that means is they have special benefits that will help reduce the cost of your Medicare premium. It's like a give back. If you choose a specific plan, it's like a little extra benefit give back that can be provided into your Social Security check if you are collecting Social Security, of course. Okay, so this slide is a slide that I've used my entire career. It is what I feel is when sitting down with clients, we can throw 100 different insurance policies in front of somebody when they're ready to apply for insurance with Medicare. But that doesn't help anybody. There is not a one-size-fits-all plan in Medicare. Everybody's needs and wants and things are very, very different. Even husbands and wives have different needs. And so therefore, what I find is the most important thing when giving people the education on Medicare is really this slide. When we're ready to choose insurance, what is a Medicare Advantage? What does that mean? How does that look and apply to you? What is a Medicare supplement? That's another term out there. If you discuss this prior to putting plans in front of somebody, it'll help them make those insurance decisions upon retirement or whatever their situation is much easier, and they'll understand what they're choosing. So I love this slide because it really breaks it down into two different buckets, that when somebody's in Medicare, ready to take a Medicare plan, if that's something they must do, is understanding terminology before choosing. So to my left, you'll see the original Medicare bucket. And original Medicare, another term for a plan like that is a Medigap or a Medicare supplement. That is one option that everybody, when they're turning 65, has the option to choose from. What makes a Medicare supplement or a Medigap possible is it is Medicare primary. So that little card that we were just talking about that you've got to pay a premium for and that you have to apply or get sent to you prior to turning 65, that would be primary payer, covering, remember, 80% first in the hospital or 80% first at your doctor. That is who your doctors or facilities will be billing first, is Medicare. As long as the medical benefits are coded as medically necessary to Medicare when they're received, those claims are coded properly, it'll then go over to the secondary, which is that supplement. There is multiple Medicare supplements in this area. They are all standardized to what Medicare approves, meaning that all the companies that offer Medicare supplements in this area and through the nation all must offer the same types of benefits, except in a few other states. But primarily every state but 3, all the benefits must be identical. The only thing that's different with Medicare supplements from company to company is cost. And that is something that we really pride ourselves in with our clients, is really shopping the market every year for people that want a supplement to try to help and advise getting them in the lowest supplement possible from year to year. With a Medicare supplement, they most importantly don't really include, I call it the fluff. They don't really give a lot of the dental, the gym, the extra ancillary benefits. They're more about giving you really good medical coverage at a very low cost in copay. So Medicare supplements, with Medicare being primary, covering 80%, and then going over to the secondary to cover mostly what's left over, they're going to be at a higher cost level monthly premium because they don't have a lot of copays or co-insurances. The other thing about Medicare supplements that are very important to people is because Medicare is first, it is extremely national, meaning that you can pretty much go anywhere in the nation as long as Medicare is accepted, which is a rarity if it's not, and be covered. So if somebody wants a second opinion at Cleveland Clinic, they don't have to check with the insurance carrier to get permission to go. They can literally just call, make their appointment, and go. So it gives that very portable feeling for other choices out of the area with doctors and facilities, but also for my snowbirds, people that may go out of the service area for more than a few months. They might want, if they're in Florida for 6 months, have more established doctors out of area, and you don't really have networks. You just have to make sure the doctors you're seeing out of area work with Medicare, which once again, if they don't, is pretty rare. Lastly, what makes a supplement a little different than what we're going to talk about next, the Advantage plan, is that the drug plan is not embedded in the insurance plan, in the supplement. It is separate. So when somebody does take a Medicare supplement, they are going to hold 3 cards. 1, the original Medicare card to show doctors, facilities, etc. 2, the Medicare supplement or Medigap card that they choose. And 3, a standalone Part D drug plan card. Once again, you don't necessarily have to take Part D if you don't take any meds, but we're going to get into this a little later. You are penalized if you don't have a drug plan 63 days from the time that your group insurance or whatever insurance ends prior. So Part D is important to take, but with Medicare supplements, it is at additional cost. Now to my right, you'll see on the other bucket is the Medicare Advantage. Another term for that is Part C. What makes a Medicare Advantage is because Medicare, even though it's super important to be in the plan, it's regulating the plan, it's watching over the company that is giving you the plan, Medicare is not first. The Medicare Advantage plan of your choice is first, and Medicare sits on the back fence and regulates it. Medicare Advantage has always been around. Another term for it is HMOs or PPOs, private fee-for-service, HMO POS, just to name a few different styles of what Medicare Part C is. But Medicare Part C or Medicare Advantage was established in 2006 when Part D drug coverage was coming to the nation. Prior to 2006, anybody in Medicare, whether you were on group insurance, you had a Medicare supplement, or what we call now a Medicare Advantage, another term for it was HMO or PPO, always had Medicare first. But then in 2006, when Part D came out, the government said, hold up, we are going to create a new program. We're going to change the landscape of insurance, and we're going to create a company or a program called Medicare Advantage, which is through private insurance companies. We have multitude of them here locally and all over the nation. But what makes a Medicare Advantage tick is that Medicare is second. The insurance company you choose is first payer. And so that's where Part C or Medicare Advantage evolved. So when you're choosing a Medicare Advantage, they are designed to be less expensive. They can range, on what I'm seeing in 2025 and into 2026, between 0 premiums to go along with your Medicare costs, all the way up to $250 in premiums. It just depends. Now with them, it's very important when people are choosing a couple things. Because you're choosing a plan, that company is primary payer, there is contracts with doctors and hospitals. So when I'm working with my clients and helping and advising on helping them choose a Medicare Advantage, if that's what they're looking for, it is imperative that we look at the doctors and hospitals that they go to, because we have to make sure where they're choosing or what plan they're looking at, their doctors are in the network. Also, their medications. There's formularies with each company, and we have to make sure that the medications that a client is taking is also under that insurance company or carrier's formulary list. So there's a lot that goes into Medicare Advantage plans in choosing. I have said this time and time again over the last 3 years. I've done this for almost 28 years now, and we used to be able to sit down with clients and help them make an insurance decision in the very first meeting. That is something that is if you're doing things right for your clients, that is a meeting that does not happen just with the first meeting. Those decisions are never made usually in the first meeting. It's a rarity. It's usually 2 to 3 meetings that we sit down and really make sure we're advising, checking doctors, checking hospitals. If somebody wants a Medicare Advantage or even a Medicare supplement, we are looking at all of the things, the puzzle pieces of you, to try to make sure that you're getting the right fit and insurance for you. With the Medicare Advantage plans, there is HMOs within them, and then there's PPOs. HMOs are health maintenance organization. Those are going to be more restricted, where your plan is very local. You have to make sure, once again, doctors and hospitals and pharmacies are in the network with that plan. If you were to go out of state and fall ill, you are covered, of course, for an emergency. But an HMO, you couldn't just say, unless you got permission from that insurance company, or there was a doctor that could not perform a procedure here in New York, you have to get permission. You can't just elect to say, hey, I'm going to Cleveland Clinic for a second opinion with an HMO. There's a lot more permission that needs to go along with that. A PPO, though, would allow for somebody, stands for Participating Physician Organization. It would allow for somebody to go out of network electively, choose to see doctors out of state. Now, if a doctor is out of state and does work with the plan or company you're with, then you're going to pay a copay like you're in Buffalo primarily. Or if the doctor is out of network, you can still see them, but you're going to pay a higher cost or a percentage or co-insurance. There's another popular plan I've been working with this year too. It's called an HMO POS. It is definitely an HMO, health maintenance, more local to Western New York, but it does give you some flexibility to go out of state up to a certain dollar amount, so that you would check with the carrier that you're with to see what that dollar amount would be. And then lastly, the Medicare Advantage plans do give a lot of the fluffy stuff, or the ancillary benefits, like the dental, like, eyes, gym. They give the extra ancillary. Some give that money back into that Social Security check, the give back money. So there's a lot of wonderful plans that are offered through Medicare Advantage in our area. It's just really fine-tuning it to the client's needs is the key. A little bit more about Medicare Supplement, just to make sure that people understand, once again, what a Medigap or a Medicare Supplement policy is. It is, remember, a health insurance that's provided by private insurance carriers, used with original Medicare, so you must have Medicare Part A and Part B to be able to apply for Medicare. Medicare is your primary. It covers all the major gaps in Medicare only if they're Medicare approved charges. So there's a lot of coding. When a doctor codes to Medicare, it has to be a specific code for it to be approved to go over to your secondary. So Medicare is first payer, and then the remainder goes over to that Medigap of company that you're with. All policies, like I said, are standardized. Each policy will be identical from company to company, but premium monthly costs will vary from company to company, except for in Massachusetts, Minnesota, and Wisconsin. Those are those 3 states. A little bit more about Medicare Advantage. Medicare Advantage, covered services and Medicare Advantage plans. Medicare Advantage plans cover all Medicare services sponsored by private insurance companies. Medicare Advantage may also cover extra coverage like gym, eye, dental, over-the-counter items. There's a lot of these carriers that offer, they're called OTC benefits, where you're getting Tums, bandages, pain relievers, vitamins, lots of little things that actually people really actually love. The drug coverage in the Medicare Advantage plans. You can't have a prescription drug plan through both a Medicare Advantage plan and, remember, we talked about standalone Medicare prescription drug plans. If you're in a Medicare Advantage plan that includes drug coverage and you join a standalone Medicare prescription drug plan, you will be disenrolled from your Medicare Advantage plan and returned to original Medicare. So back in 2006 and 2007, I'll give a little story that will help explain this better. When Part D had been just coming out, Medicare Advantage plans have been around for years, and we'd have clients with a Medicare Advantage plan, and the drug plan, remember, was included starting in 2006 and 2007. And they loved their health insurance, but their drug plan might not cover one of their drugs. So they would go online or call an insurance company that offered a standalone Part D. And those people would shop the market and they'd say, well, listen, I love this company I'm with, but this one drug is not covered under my company's plan. So I'm going to sign up for this standalone drug plan to help supplement the one drug that's not covered. Can't do it. Because the second you enroll, if you're in an HMO or POS or any Medicare Advantage plan that includes drug coverage in it, and you sign up for a standalone drug plan, it will cancel out your Medicare Advantage and you will be left with just original Medicare, which you'll still have a drug plan because you signed up for one, but only then will your medical expenses at doctor, hospital, etc. be covered 80%. So in 2006 and 2007, I remember that was a real issue. People were not advised properly and they were, or trying to do things on their own and not knowing the rules. And that is why I've always mentioned this in my presentation. Be careful with that. Be very careful with that. Okay, a little bit more about Medicare Advantage plans. Rules for Medicare Advantage plans. Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans. These companies must follow the rules set by Medicare. So some people think, well, goodness, I'm signing up for this Medicare Advantage company. Medicare's not my primary. Like, why do I have it? Well, you must have it. You cannot apply for a Medicare Advantage plan without Medicare A and B. But remember, Medicare is still absolutely involved. They're overseeing, the insurance company is following the rules of Medicare. It's just on the back fence. However, each Medicare Advantage plan can charge different copays and out-of-pocket costs. Most companies have different rules for how you get services. For example, if you choose one company, you may need a referral to see a specialist, or you can only go to certain doctors, hospitals, facilities, or suppliers that contract with your plan for non-emergency or non-urgent care needs. These rules can change each year. So really, once again, in a nutshell, not to sound repetitive, but Medicare Advantage plans, every plan offers different things. Even though they're set by Medicare's rules, they're allowed to choose different doctors' networks, different copay structures. So really researching and looking at those things on what your needs are will help you look and find the right plan. And keep in mind that these plans change every year. As of last week, the 1st of October, we are in the beginning stages of annual enrollment, and it's been a doozy so far, preparing for 2026, making sure people know of the changes. There's a lot of changes to insurance in 2026, and the carriers and the doctors and hospitals they work with. It's been on the news over the last few days. So these are very, very important things that is really paying attention to when choosing or working with clients with Medicare Advantage. A little bit more about prescriptions. I would say in my career, prescriptions have been, I feel, probably one of the most important things with clients that take pretty big meds. It's a lifeline. People that are diabetic, people that have insulin and inhalers and injectables, biologics, the medication industry as we all know, we see every day on the TV, the commercials, is life-saving, life-changing, but it comes at a cost to all of us. And sadly, in our Medicare population, it's so backwards because it seems as if those individuals are paying more than our, under 65 population. Now, in 2025, there has been a lot of change to the rules and for the better for the beneficiary. But every plan has different formularies of drugs they cover. And what formulary really means, if you didn't know, I've said this word a couple times, a formulary is a list of drugs that the insurance plan covers. Medicare provides guidelines about the type of drugs to be covered, but not the specific drug. Each plan has its own formulary, even within each company. Each company can offer 5 different products, and formularies can be different. Medicare has excluded some types of drugs, but some plans may include them as part of an enhanced formulary. So formulary, that's what that means. When I say formulary, it's a list of medications covered within a plan. So in 2025, what I was talking about, there was some real big changes for the better for the beneficiary. There was a rule now set by the Inflation Reduction Act, IRA, that Medicare beneficiaries will now have a Part D maximum out-of-pocket in 2025 of no more than $2,000. And in 2026, that will be going up, luckily only $100 to $2,100 cap. Starting in 2025, the coverage gap, or another term for the donut hole phase, was eliminated. So anybody that remembers donut hole, that was a big word for years, and still is no longer. Members will now have a simplified 3-phase benefit set up, which consists of first initial deductible phase, if applicable, depending on the plan. The initial phase where you pay co-pays or co-insurance is up until the $2,000 this year or $2,100 next year. And then lastly, the catastrophic phase. So what does this all mean? In a nutshell, last open enrollment, as I sat here doing this exact thing, we were excited to share that the donut hole was being eliminated. And so basically what that meant is for years, since 2006, when Part D was initiated, people were given a specific amount of money towards their medications between what they paid and what the insurance company paid. And the behind the scenes, the government gave everybody this certain amount of money, about $5,100. It ranged over the years. It went, from $4,000 up to like $5,100 when it ended in 2004. So some people never hit that $5,100. They never hit that maximum out of pocket because they were on little drugs. But some people did. And when people would get to this $5,100, let's say, then they would fall into something called the donut hole or the coverage gap. And they then would be responsible for 25% of the retail cost of the drug until they reached catastrophic, which was $8,000. It was a lot of money. People wouldn't fill their meds. I had clients actually pass away from not filling their meds. Some people would go to Canada. There's other programs out there called low-income subsidy where people that had specific income requirements would be okay. Or EPIC, which is a New York State pharmaceutical program. There was help out there, but some people were over those income brackets to get the help. And it was $8,000 that they had to get to before they got to zero. Now, some people on biologics, some of those new injectables out there, there's multiple drugs out there, of course, would get in and out of that catastrophic phase fast, but some didn't. So last year, when we were preparing for exactly this annual enrollment, the cap going from 8 to 2,000 was monumental. I had people coming into my office, I was running their medications, and then the very first fill of the year, they hit that $2,000 max, which still is a lot of money, but it's better than 8. And they literally then, once they hit that, the remainder of the year, their meds would be zero. It was huge. This coming year, the cap is $2,100. Some people still are not going to hit the 2,000 even. There is sometimes, I know this year going into 2026, There's a lot more deductibles in the beginning part of the year to help the insurance companies out with the bottom line. So there is a lot of plans we're seeing into 2026 that they have some sort of first fill deductible on higher cost meds, brand name meds. The deductibles can range between $150 to $615 for the first fill, but then pretty much copay or co-insurance until you get to the $2,100. So those Part D changes that hit this year were huge and a blessing. Some people, when they'd meet with me years ago and planning for retirement, because they were high utilizers with medications, they were waiting to retire because the costs of the meds under group were so much less expensive. But this year, it's providing them the opportunities, believe it or not, to feel like, okay, I know $2,000 is still a lot of money, or $2,100 is still a lot of money for many people, but at least there's a max cap, and that's huge. Part D penalties, which I know we've talked about a few times. Part D, you may owe a late enrollment penalty if, for any continuous period of 63 days or more, after you enroll in Part A, or your credible prescription coverage ends, you will be penalized. What does credible coverage mean? Credible drug coverage means that your employer group insurance or private insurance must have a drug plan embedded in the insurance plan that is equal or better to what Medicare can offer you once you are 65. If you are not covered under a credible drug plan through your employer or private plan, you will be penalized 1% for every month that you do not have a credible drug plan in place. This is once you're 65 plus or take Part A. This year, it is very important for people in HSAs that they want to continue into an HSA, that if they're under group insurance, they check with their employer that if they're remaining in any kind of plan, actually with employer, not just high deductible HSAs, that the plan does have credible drug coverage in it, because then you may have to make a different election if you want to remain under group insurance. You have to make sure that the plan in your group plans are credible drug coverage. And the penalty will stay forever. It doesn't go away once you take a Part D. It's indefinite. Okay. Medicare versus group insurance. So Medicare versus group insurance. Timing is everything. We ask people to start this journey early if they can help it. Primarily about 4 to 6 months before you anticipate enrolling in Medicare. Contact me as soon as you're ready to retire, or if you're even just thinking about retirement. I mean, my favorite type of client to work with is somebody that is just trying to kind of navigate financially really what Medicare looks like and compare it to their group insurance. It's just wonderful to work with people like that and helping them prepare for retirement. It's so rewarding. So, as soon as you see retirement and you have questions, you're thinking, can I afford to do this on the insurance side? Just wondering what Medicare is all about because you're being inundated with solicitation. We will do that and help you with that. I will review your personal situation, your daily medications, your doctors, and all your personal needs. We together will compare the plans offered in Medicare within your state and county, or if you're offered retired group insurance choices. We will research those daily needs as well as expected premiums and copays. Another thing I love to do is if people are offered retiree group insurance through their employer once they retire, let's compare that to non-Medicare plans just to see the difference. I will complete a Medicare review to allow you to plan better for your retirement and be better prepared for this transition financially. Medicare versus group also continued. In some circumstances, when making decisions on choosing Medicare, that spouse that is younger than 65 will play a big part in that Medicare decision. Always looking into your group option of COBRA, if offered for a younger spouse, and comparing it to New York State Marketplace plans is always a very good idea. The Sable Insurance Agency will make sure we help you explore all your options so you can make the best informed decisions for you and your whole family. Just a few things that I want to put out there. For people that are already in Medicare, we are right now heading in to our annual enrollment period, which we can start talking about products and changes October 1, but we can actually start sitting down with people, changing their insurance if it's necessary, October 15th through December 7th. So anybody in Medicare, when you see those commercials on the TV already starting, all the news, papers, mail, whatever it is, phone calls even, that is because we are in annual enrollment between October 15th through December 7th. And this is a time where you can switch and change your plans pretty much in New York State. We are a non-medical underwriting state. You can choose and change your plans to pretty much anything you want. There's also another Medicare enrollment period, which is the Medicare Advantage Open Enrollment Period. This is another one that gives us a little bit of cushion for people already in Medicare that might have missed the first one this fall. They have another time of year between January 1 and March 31st where they can still switch to certain plans. There's a little bit more limitations on the plans you can change to, but you can switch during this time too. I am putting in right now my contact information in case anybody has further questions, wants to set up a phone call appointment, a Zoom appointment, or of course an in-person appointment. My information is on the screen, my email and my address. And I just want to thank you so much for your time today listening to me. And also Level Financial, once again, thank you for trusting in me with your clients. It's such a privilege, and I just absolutely love working with you. Thank you, everybody.